So welcome all. This is Vivek Singhal reporting from Bangalore, India. Thank you all for joining. And let's get started. So today we have a panel discussion with Dr. Akhil on oncology research and utilizing Gen AI capabilities for this particular task. So let me introduce Dr. Akhil, who's already on the call. Dr. Boyina Akhil is a MBBS general
Uh,
physician.
Good morning, Vivek.
Yeah, good morning, doctor. So hope you are doing well.
Yeah, I hope.
So let me make a brief intro. Dr. Boyina Akhil is a general physician, graduated from Davao Medical School Foundation. He's currently working at a mother and child care hospital. You are in Andhra Pradesh, doctor, is that right?
Yeah, Andhra Pradesh.
Okay, so he's focused on providing quality healthcare for, mothers in general and neonatal situations. The today's discussion, however, is on oncology researchers using chatbot for medical research. Dr. Akhil, shall we get started?
Yeah, okay, started.
Okay, let me share my screen. So today's discussion is focused on, using Gen AI chatbots for oncology research, and we will try some prompts in chatbots. Our focus as CellStrat is on our own chatbot, which is called CellBot. Let me share my screen, and I'll be, just talking to Dr. Akhil in a fireside format, and we'll be seeing if Gen AI can help answer some questions. I guess people are still joining. Let me, yeah. So Dr. Akhil, what is your view on the potential of Gen AI, and LLM chatbots in healthcare or healthcare research? An open-ended question, so feel free to answer as you should.
Can you repeat again?
Yeah, what is your opinion about this AI interventions in healthcare? Are you
Uh,
using these bots in your profession or research? Are other
uh,
doctors using it?
no. At present, we don't use any AI bot related. But in recent Hyderabad or any other place, one AI bot is recently used for like for CBC reports and everything. They detect the early stage of cancer.
Got it. Now, uh, now you represent a tier one city hospital doctor, or you are more of a in a tier two town in Andhra
Yeah,
Pradesh?
town in Andhra Pradesh.
So is it a smaller town, or are you in Hyderabad or?
No, smaller town.
Okay, okay. So do you feel this phenomena of Gen AI, chatbots? Because in Bangalore, when I visited medical colleges like Bangalore Medical College, Victoria Hospital, KIMS Medical College, and many others, St. John's. So a lot of the students and doctors were saying that they're using, let's say, Chat GPT predominantly for healthcare research. So what is you don't see that in the tier two towns, perhaps, right? Am I right?
Yeah, in towns, no.
So what is the reason? Has the word not reached in tier two cities, or is just that the behavior of the doctors in metropolitan cities was
So in towns, what were not reach. That's why we don't use any AI bots or everything. And they are not developed like Hyderabad metropolitan cities like Hyderabad, Bangalore, and Mumbai.
but this is just internet tool, right? So
Internet too.
so has it not gone viral in smaller cities with the
Yeah,
medical
yeah.
community?
In smaller cities, they are not viral.
I see, I
So,
see. So for us as a company who's making GenAI solutions for healthcare, we consider this good actually. So which we by that I mean that it is under penetrated. The potential of AI is under penetrated in tier two towns of India particularly, and we are focusing on India as a country right now. So assume in other countries also it's a similar situation. So this Gen AI or chatbot is the awareness is more in tier one towns or more renowned hospitals which are existing in metropolitan cities, and whereas other hospitals and tier 2 town medical community is not yet adopted GenAI. Is that a correct analysis, doctor?
Yeah.
Okay. So I'm actually happy to hear that, because as a company, we want to be sure that we are not yet late to the AI, party, if you will. But really, the idea is to help the healthcare community and the patient community with healthcare, and bring the power of these new technologies to the benefit of healthcare and the community at large. That is our goal. So it's a mission-driven mentality, and we say when we started to pick an area to focus on as a company, we said let's focus on a vertical. So we were exploring various areas, manufacturing and others, financial services. We thought that healthcare is very personal to each individual, to each family, and in our family members or extended family or friends, we have seen a lot of issues around healthcare. And with modern lifestyles, of course, it's worsening, as you know, whether it is lifestyle diseases like diabetes, thyroid, cardiac, and plus, of course, options. So we thought healthcare is the right industry to apply AI to, and that is what started our journey in healthcare about 1 year back. And since then, we have been making this bot. So, Dr. Akhil, did you try ChatGPT or CellBot, any of them so far?
No, actually, yesterday I was busy. That's why I don't try your chatbot.
Okay, so that's
Last time
Hmm.
you give me one example on chatbot, right? CellBot, I think. Some studies, journals, our first meeting in our first meeting.
Correct. Correct. So one common theme we see is doctors say they are so busy serving because the doctor-patient ratio is still very adverse, right? There are very few doctors and the patient overload is
Mm.
extremely high, particularly in larger hospitals or government hospitals. Uh,
Mm.
so uh, so we always say that definitely we feel that AI can play a role, and because the growing population which is seeking quality healthcare is not being served by the limited healthcare community, and doctors are overloaded. Is that correct, Dr. Akhil?
Yeah, yeah.
So I met some doctors in government hospitals in Bangalore who said, I can see up to 250 to 300 patients a day, and that just dazzled me. How can one doctor see 300 patients in one day?
One
Uh,
day, actually, they divided 300 people. Like so many government doctors are there in the setup. That's why each department has separate doctors. Nearly six doctors in one department, 6 to 7 doctors.
I see. So yeah, I mean, I could imagine the exhaustion and which a doctor is likely to feel by the end of the day, and uh, clearly their ability to look at AI tools in between is not there because they don't have time to look at those tools because they have a massive patient surge waiting for them. Now, even when I go to private hospitals like Manipal, which are
Oh,
quite, yeah,
Manipal is also is a big hospital. That's where nearly they treat so many in one day they look for many thousand people. I think
correct, correct. So whether it's private or public, the patient load is very obvious.
very obvious.
Even after paying a consultation fee of rupees 800, 900, 1,000 in some
We
hospitals.
we we previously book appointment on in private hospitals. In now future days also in government also they put a setup like a previous of booking appointment order previous.
Right. So I have to still wait for sometimes 2 hours because there is
Yeah,
such a queue of patients to see that doctor, right?
yeah, right.
It's so absolutely crazy. Even after paying huge amount of fees, there is long waiting time. So clearly, doctors are overloaded. and there is a patient surge. So we feel that AI can help, and many doctors and medical students and principals have attested, yes, indeed. Uh,
So not
we-
100% AI will help. Nearly 40 to 50%, right?
so what do you mean by that 40 to 50%?
So like sometimes we give treatment on based on symptoms and how we look our patient. In some results, AI will get AI will didn't get the false negative results. Like patient is not positive, but AI will get the result positive. But we don't abuse. We don't mainly treatment on results on only we don't give any treatment on positive results only. We based on symptoms and how will patient appear like that.
Right. So your view is that AI can be hallucinating or
Yeah,
give incomplete
like
answer.
it will be helpful for only 50%, 50 to 60%, right? Not completely.
Got it. Yeah, I do agree. So because AI is still a work in progress technology, it is not generalized AI where it can be as intelligent as a human, medical expert. So it doesn't have the insight development capability. We are still kind of somewhere in between in that journey. But we suspect from a tech community, we think that maybe in few years we will have generalized artificial intelligence, which will be able to do better. But as of today, yes, you cannot rely on AI. And anyway,
Yeah.
I'm not saying AI will diagnose doctors. It is an augmentation tool in the hands of the doctors and medical
So
experts.
diagnosis is based on based on history only, based on history and lab results.
Correct, correct. So we agree with that.
So
We are
no, 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 not only the patient blood test or anything. Just
yeah,
focus on history, family history, like everything.
right, right. So we are on the same page. We agree that it cannot, and we are not at all pushing it like a diagnostic tool. We are saying that these are augmentation tools, like doctor may use spreadsheet or Microsoft Office, right?
Oh,
Or internet or email. So these are tools to help the doctor improve their productivity. For sure, it cannot diagnose or
it will be helpful. Your tool is helpful, like save the time,
correct, correct. Help doctor with time saving tools.
time saving.
Yes, and help them in continuous medical education, if you will,
Yeah,
or so it definitely these are tools in the hand of the doctor or the medical student or a nurse, whoever, to improve their productivity and help patients, more patients with
more
less.
patients and best treatment.
Correct, correct. So let me try one of the bots we have. It's called CellBot, which in CellStrat as company we are developing. So, doctor, the today's topic was primarily oncology research. Uh, would you like to give me a question which I can ask of CellBot?
So try to make question on breast cancer. In India,
Oh,
females are mainly on breast cancer only.
right,
Most
right.
of the females are, in many cases, females have breast cancer in India.
Yes, I understand. Let me just log in here. Just a moment. One second. Okay. So let me ask some questions about breast cancer. So breast cancer is the most prevalent kind of cancer among females in India. Is that right, doctor?
Yeah.
Okay. I'll just ask some generic questions. So what this tool does, it goes to authorized medical sources such as WebMD, Mayo Clinic, PubMed, NIH, and it will find the relevant articles where this question could possibly be answered, and then uh, it will, generate the answer using GenAI LLM. So As you can see, it compressed my question into a semantic phrase, which it will search in these sources, which is lists, and it found the three matching articles, and the three matching articles are in Mayo Clinic website, CDC, Center of Disease Control Atlanta, and NIH US. And then it says finish thinking. Then from these three articles, it it generates this answer. So doctor, I just wanted your thought on how this answer looks to you.
So basically, breast cancer treatment is based on their stages. These all are given to the patient, but treatment is divided on based on stages.
See, I asked a very general question: how to treat breast
Yeah,
cancer.
okay.
So for a very generic question, does this make sense? Increase the font a bit.
Okay, it will be okay.
Generic
Here is
question,
the
generic answer, not very specific.
specific answer we will get. The treatment plan is personal based on the cancer stage.
Yes, yes. So I'll ask that next.
So,
Let me ask that follow-up question. Can you advise the same for various phases of
can
the also?
stages, not phases.
Oh, okay, got it. Also, how will you personalize the treatment protocol? So the two things you kind of mentioned, so I'm putting that here. Let's see what it says. So it compressed that bigger question into the phrase breast cancer treatment by stage and personalization. And it found three NIH websites which will answer this. So here we have guardrails in this product, which it will not go to general internet. It will only answer based on specific, sites. We have listed a site of authenticated, medical sources, and so that it will not hallucinate using generalized internet information. Because these are very sensitive areas, and we wanted to create a highly specialized medical bot. So let's review the answer. So how do you feel about it, doctor? I'm not saying it's perfect, but do you find this is helpful?
Yeah, it will be helpful. Surgery is the main treatment.
Yeah. So you think the answer is somewhat okay?
Somewhat okay.
So as a neonatal doctor, are you involved in oncology for breast cancers or female cancers?
No. Actually, I'm not involved in breast cancer, but your topic is oncology. That India is mostly in females. In many females in India will have breast cancer mostly.
Yeah. So this answer looks reasonable to you.
Reasonable.
Now, are you aware of any non-invasive techniques apart from surgery?
Non-invasive techniques like in breast cancer, no non-invasive techniques. Only for surgery is the treatment.
So chemotherapy and hormones will not work, huh?
It will be helpful in some stages. Chemotherapy, like a triple
Okay.
negative. Here there are stages like hormone receptor sensitive. There are three: luminal A and luminal B and luminal C, like that. So try to look at stage 3, stage 2, stage local advanced breast cancer. The chemotherapy before the surgery and later surgery and radiation follow.
I see.
Based on the receptors like HER2 receptor.
So you will go in three steps. You will start with chemotherapy. Then we will do.
For likely there are three stages in cancer: early stage and locally advanced stage and metastatic stage. In
Okay.
metastatic stage, they go to the lymph nodes. That was the severe stage of the cancer, final stage.
So what
Not
is the ultimate solution? Ultimate solution is breast removal surgery, huh?
breast removal surgery. Yes, ultimate surgery is breast removal.
I see. And before that, you'll try chemotherapy, radiation therapy, etc.
Early some total in early stages we remove only somewhat of breast where the tumor is there. That type of tumor is located in the breast. That part will be removed in early stages.
Got it. Got it.
So after that, based on the first chemotherapy, later surgery.
Okay. Got
In final stage, we remove total breast.
got it. Now, do you think breast cancer can spread to other parts of the body?
Yeah, metastasis to other parts also, about like
Oh, it
liver,
can, huh? Okay.
bones, liver, and everything.
Then it's very hard to fix, I presume, right?
Yeah, that was the final stage.
So you want to prevent that from happening. So you will intervene with the breast early on so it doesn't become metastatic, right?
Yeah,
Okay. So let's see the source of these sites where this question was sort of. So this was one of the PubMed or NIH websites where it got the answer. So this is what this bot does. It limits its answers from these certain specific sites only for authentic information. Why we developed this bot? Because we were told that ChatGPT gives very general answer because it scans the whole overall internet. So doctors and medical students wanted a very narrow list of sources where the answer may be found so that the information is more authentic.
Vivek, one question is that the question you have prompted in the CellBot, if you ask this same prompt in the ChatGPT, can you find the difference? What are the difference? As this is more specialized in medical.
So as of today, I am not claiming ChatGPT will not outperform this tool. It is. I have not tried compare it really, but I suspect that ChatGPT could give better answer as well. So it is not my goal to do a benchmark against ChatGPT as of yet, Partha. So we are still a few months away where we'll benchmark against ChatGPT, but as of today, we are not making the claim this is better than ChatGPT. Does that answer your question?
Yeah. I'm not comparing with ChatGPT, but with this current state, I just want to see that the difference or anything that, or maybe a year later. Also.
Yeah, I mean, yeah, because that will take more time. So you can feel free to try on your own. But as of today, we are not making that claim at all. And I did try roughly before, but in some cases, ChatGPT was definitely giving better answers. So, but we are on a pathway or a journey to make a better bot. So we are not there yet.
Yeah, nice. Thanks.
So we found a clear need where doctors and medical students reported they are not satisfied with the general bot answer. So that is the reason we started building CellBot, because many doctors and students continue to insist the answers from general bots were suboptimal. So, and hallucinating. So that's why we thought that there is a need for a more specialized medical chatbot, which can, where the doctors and students can safely, rely on it. So, Dr. Akhil, you want to ask any other question, or how do you, and you can see the follow-up questions. It's
So like it will be helpful to like staging or what
sorry.
staging of the cancer.
So, what is
So
the
what
exact
it
question?
so like tumor size is less than 2 centimeters. So,
Yeah. Then
and it will be ipsilateral to the mobile axillary nodes.
can you type your question in Google Chat or WhatsApp to me?
Yeah, okay. I will WhatsApp you.
Yeah, I want to ask question you want to ask because I don't have domain knowledge. So meanwhile, let me ask this other thing.
Vivek, one technical question can I ask?
Sure.
In this thinking stage, how it is showing this searching and this and reading this? Any technical part? Mm.
So we are print. So basically, first thing we did was we took the large question, compressed into a search stuff expression, right? This one.
Correct.
So this is then sent to these sites using the scraping API, right?
Hmm.
And then it search the scraping API searches for this particular phrase in the relevant sites. And
Hmm.
then once it finds the matching pages, it embeds those pages to create the correct answer.
Hmm. The entity extraction and the finding the dependency that is happening during the reading time.
I mean, it's just semantic match, right? So
Correct.
actually, the web scraping APIs do this out of the box nowadays.
Hmm.
Web scraping API will be able to search for a certain phrase. So this is the phrase being sent to the web scraping API, and
Hmm.
it is only scanning the sites which we have listed, the few select healthcare authenticated sites, and then it is finding the matching articles, and it is embedding them in the vector store and then doing usual RAG.
A rag is anyway behind it. Yeah.
Got it. Yeah, it is. I mean, the RAG is involved. Yes, there is a vector store at play. Let me
Correct.
take Dr. Akhil's question here. So and ask because this would be a more specialized question. So Dr. Akhil, I'm going to
Yeah,
substitute question here. Refresh it. Okay, what is the stage of the cancer and treatment if tumor invades you're asking about invading, right? Invades the to chest wall and fixed artery units. Okay, got it. So let me ask this question. So kindly verify if the answer is correct.
yeah. Oh, can you down?
Yeah.
Okay. Can you down local therapy?
Hmm.
Okay.
So
Yeah,
far, so
okay. So like 80% is okay. 80% is correct, but 20% is so surgery is also the treatment for this case. Total mastectomy, but in surgery is also you use it for the treatment of this cancer. But answer is
let me ask it a question. Why you didn't recommend surgery for
yeah,
above in this case? Correct. This is the question you want, right?
yes.
Okay.
Okay. Okay, correct.
Or you think it is right, huh?
Yeah.
Okay, so you actually agree with the answer, huh?
Yeah, I agree with this.
Okay. So you are saying surgery cannot help much now since it has
But
become
so
better.
after resolving the symptoms, surgeries will be helpful.
Right. Okay. Okay, any other question you want to give me, doctor? You can type
No,
it.
no. I don't have any other questions.
Okay, anything else in oncology you can suggest?
To try to on esophageal cancer also, stomach cancer is also a burning problem in India. Try
Right,
to make sure.
got it. How to solve prevalence of ESO?
Esophageal.
Is that right?
Wait. I will try that spelling.
Okay, let me get the spelling. ESO.
I will send you.
Okay. You should be able to pick it up. It does automatic spell check. Okay, it is searching. So because it has to search designated sites, and sometimes I've noticed it takes a minute to find the matching articles. So esophageal is intestinal cancer, doctor?
No, not intestinal cancer. That food pipe cancer.
The food pipe, okay. The top part of the
Top
food,
part of the.
okay. So it found 3 sites where this answer may be found possibly. So how do you feel about this, doctor?
Oh, okay, it will be. Yeah, it will be. It will be the treatment for the esophageal cancer.
So this seems right to you, huh?
Yeah. Yeah. Right.
So let me give it a positive feedback here. So it says submitted feedback. I can mention this. The answer was useful and correct. So we can give feedback like this. So we are correcting, hoping users will give this feedback so that we can improve this chatbot based on user feedback. If you don't like the answer, you can always do a down thumbs or thumbs up, thumbs down, right, for good or bad answer. You can even copy it and paste it in your research article or your Word doc or wherever you want to paste it. So any other specific question on esophageal cancer, doctor? Can you send me in WhatsApp maybe?
Specific question. Okay.
You can type the question in WhatsApp. I'll paste it here.
Vivek, when the answer is not available in the source, then when it is available, it is showing searching and reading, but it is not available that time. Even searching should display. Here, searching is also not showing at all. The previous question is
There is
Vegas.
the, no, it was searching for sure.
It was searching, but the word previous go one prompt earlier,
Mm-hmm.
where the first question on the esophagus, there first time it was showing that.
No, no, it was it was stuck for me. So I refreshed the screen.
Okay.
So I actually, I refreshed the session because it got stuck for me. It's still work in progress tool. Sometimes you have to refresh the browser.
I see. Okay.
Yeah. So we're still working on the tool. Doctor is sending me a question. So, so idea is to definitely collaborate with the medical community and with their guidance, develop better tools like this. Without the domain expert, we will not be able to do it. Immunotherapy, tumor staging information. Okay, so let me see the question doctor sent. Let's ask this. So doctor send me one question. Let me copy that. If tumor is invading pleura and no lymph node involvement and no metastasis, what is stage and treatment? Fine. So Dr. Akhil, I hope you are liking this tool and will try to
Yeah,
use it. Right. I know up till now you don't use chatbots. I mean, you kind of don't time and you don't need it also, I understand. But I wonder if it
but
can be useful and you would use it.
it will be useful for only nearly 50 to 60% only, not completely useful.
Yes, yes, I understand. I mean, doctor has to apply their expertise for sure.
Yeah.
So check the answer.
Okay, answer is correct.
Oh, that's good to hear. It was a bit complex question. So I was thinking, so it is able to answer correctly, yeah?
Yeah, come to summary. Summary.
Okay.
Stage four, next. Yes, it is correct.
It is correct, huh?
Yeah.
That's good to hear. And the specific site it got this was from PubMed again, PubMed Central, Journal of Thoracic Disease.
Vivek, in PubMed, all types of answers are available with all the documents available there.
I mean, there are millions of papers and more are being added. So till date, we have not found a question which it could not find.
I
Partha.
see. Okay. Okay.
But I cannot tell you for sure that every possible question will be answered. But
Mm,
till date, we are yet to find that question which cannot be answered. The
okay.
quality of answer can vary. Sometimes it's not so, elaborate, which a doctor may approve of, or a bit hallucinating slightly, but not so deep maybe. But it is able to answer everything we ask so far.
Okay.
Because, PubMed and between, see, we are not just doing PubMed, we are instrumenting Mayo Clinic, PubMed, NIH, NHS. We have up to date also very popular site for healthcare. So we have covered the most major sources.
Good.
So it is very unlikely that none of these sites will have the answer to any specific question. So
Mm,
one or the other site will have an answer, right?
yeah.
Because these are the most trusted, most dependable, among the open source sources at least. Not these are not paid APIs we are using. There
And
are
on
like Lancet Journal and they are paid sources also, but we are using the open source sources.
okay. And on top of that, it is merging the answers before generating. Is some parts from PubMed, some from Medline. Is it merging or these answers are from one single source?
No, you can see in this question, it had three sources. See, it embeds them, right? So
Embeds.
once the three pages are embedded,
Mm.
then it is basically, then it is a cumulative embedding, isn't it?
Exactly, that is what, yeah.
So it is merging the embedding, and after that, it answers from the combined embedding.
Mm.
Then it does RAG, right? So once it is embedded, then it will do the classic RAG, whichever paragraph gives the correct answer, regardless of where the original source came from.
The cumulative part is the important here. It is merging all of them.
Yes. So, doctor, you like this answer, huh?
Yeah, I like that.
Now, doctor, I have a question. How to
What?
prevent? Has humanity progressed to a point where we can prevent cancer?
So we can prevent cancer based on we reduce the risk factors. We can prevent the cancer. So smoking is the one of the most risk factor for the cancer. Like for example, we take esophageal cancer. Okay.
Yeah.
So esophagus risk factors are like smoking and smoking related factors. So can you type risk factors for esophageal cancer?
Risk factors.
Risk factors for esophageal cancer.
Okay. One sec. Correct. So spelling it will correct. Spelling is not a problem.
Yeah.
Risk factors for esophageal cancer. Let's see that.
See, you got our risk factors for esophageal cancer.
Sorry.
Smoking is the one of the risk factor for esophageal cancer, and betel nut, so crane or everything.
Mm-hmm.
See, these are the risk factors.
Mm.
Like tobacco is one of the risk factor.
I see.
So alcohol consumption is one of the risk factor. Like sometimes you get acidity from the stomach, right?
Mm-hmm.
That is also one of the risk factors. So the fourth one is that one, gastroesophageal reflux disease.
Oh, the GERD. Okay. So this is
Yeah.
acid reflux can cause esophageal
Acid
cancer.
reflux also, yeah, esophageal cancer.
Oh,
Some
interesting.
cases.
Oh,
And
I didn't.
obesity, like fat people.
Mm-hmm.
And
See,
sometimes
in India, we all eat spicy, oily
spicy
food.
foods are that. So we don't take any outside food too much. So limit is good.
So we should not eat outside food, you're saying.
Yeah. And sometimes a certain carcinogens in environmental exposures, like some are working in shipyard workers or coal mine workers are there.
Uh-huh.
So that sometimes fuels. Some are working in fuel stations like petrol bunk or everything.
Uh-huh.
So that fuels some carcinogenic compounds also cause cancers.
The toxic fumes of the petroleum.
Yeah, use biomass. That one seventh in environment exposure. You see that one.
Right.
So
Environmental.
some virus also.
Oh, viruses can cause esophageal cancer. Okay.
Yeah, sometimes HIV infections and
I see.
HPV infection. So these are the risk factors for main type for one cancer, like esophageal cancer. Heavy smoking is also the risk factor. Like there is one epithelium in esophagus that will change to the other epithelium. So it will metastasize. So that and that way, in that reason we got cancer.
Got it.
Got it?
Dr. Akhil, here one question is the ranking also correct? Means the tobacco is the top and second and then gradually decreasing. So is the ranking is also correct?
What? Yeah, ranking is also correct. Like mainly smoking is the main affected factor.
Number one, followed by alcohol.
Followed by alcohol and followed by dietary factors.
Mm.
So followed by these are ranking is like this.
So the infections becomes the lowest if I take only top eight.
So like infections are HPV is not only causes the esophageal cancer, but it will be also some other cancers also.
Right.
Like HIV is also not only cause the esophageal cancer, it will cause another cancers also, like Kaposi sarcoma. There are so many cancers.
Mm-hmm.
So that's why they put that in a low preference for viruses. So mainly first three conditions are the main risk factors for these. First four conditions main risk factors for the esophageal cancer.
Now, how about these Ola Uber drivers, the EV electric vehicle, food delivery guys?
So
They are always consuming fuel, right?
no,
Fuels.
not fuel, not fuel. That was someone working in working industries like environmental factors means.
You mean in industry or in
Yeah,
petroleum?
industries, petroleum industries, and like glass made industries are there, right.
Right.
For example, you work in coal mines.
Yeah.
Some people are right. They got lung cancer.
Can pollution cause lung cancer or
Pollution,
esophageal cancer?
yeah, pollution is also cause lung cancer. For example, can pollution cause cancer?
Because we are all victim of pollution, right?
Yeah. So pollution also have some type of minor carcinogenesis there.
Right.
So if we are able to solve, let's say, one type of cancer, then how deterministic it is to solve majority of the cancer? Because there are so many varieties of cancer: lung cancer, breast cancer, foot cancer, even multiple myeloma, blood cancer, so many. So if we solve at least one of that, is it easy to solve others or majority? How? What is your take on that?
So question for me or Vivek?
Yeah,
Yeah,
Dr. Akhil, so can treating one cancer solve other kinds of cancer?
So question
PNP.
for me.
Yeah, for you.
Can you repeat it again?
Treating one cancer, how easy to solve other cancers also? If today
So
in
treatment is different from one cancer to another cancer.
Hmm.
Okay.
Hmm.
If your cancer is on esophagus, for example, we are discussing on for now esophageal cancer. So your cancer is on esophagus. You will treat on only esophagus cancer. Okay.
Okay.
So,
So
Partha, we
so
cannot.
treatment is different.
Yeah.
So we can only for treatment for only we can give only treatment for esophagus cancer. If that cancer is metastasized to other organs also, we first slowly one organ.
Got it.
Okay, got it. And
Yeah.
every cancer has different type of treatment. For breast cancer, we remove the breast or some part of the breast, and chemotherapy. For bone cancers, we remove the bone marrow, bone transplantation surgeries.
Hmm.
For multiple myeloma and blood cancers also, we remove bone marrow and multiple bone marrow transplantation.
Okay.
Got it. Yeah.
Okay, got it? You got it?
Yes. So for bone marrow, there are few genes like NRAS and KRAS. So
Yeah. So bone marrow is the main for production of the blood, right?
correct.
So blood-related cancer, we can treat the bone. We can replace the bone marrow like that.
Okay.
For leukemia.
Leukemia. Leukemia treatment is mainly on prognostic factors. There are some prognostic factors for leukemia. We can give like a tyrosine kinase inhibitor.
Hmm.
So for leukemia, PMR, LMR gene, that different cancers are different type of genes, different type of treatment, different type of medications.
So, doctor, is this answer correct? What it said? Can pollution cause this cancer?
Yeah, there one pollution is the nitrous oxide, and particulate matter is PM 10 2.5.
Mm-hmm.
So that causes also cancer.
Mm. The
So mainly
particulate,
pollution is for lung cancer.
right, right.
So if you are not smoking, your friend is smoking behind you, you will be affected more than the smoker friend.
Oh, is it?
Yeah,
So you're saying passive smoker is more at risk than actual
more at
smoker?
risk than this. Yes, passive
Oh,
smoker is more at risk for cancer
that's
when
very bad.
compared to smoker.
That's bad. My friend is smoking and I am more at risk.
So
Okay,
that's it.
I see. So I should run away. Whenever somebody is smoking, run away.
Run away.
Okay,
Or
got
even if you can't run away, at least start smoking.
it. Okay, fair enough. Got it. So any other questions, doctor, you want to ask on oncology?
Oh no, I don't have any other questions.
Okay. Now, what about babies? You deal with babies, doctor, right? So I
Yeah,
hope we don't see oncology issues with babies.
actually, babies also oncology issues.
Oh, is it?
Yeah, leukemia, ALL, acute lymphoblastic leukemia is one of the risk is mostly seen in babies.
So shall I ask this question?
Yeah, can you ask the question?
Can babies be impacted by blood cancer?
Hmm.
That's very traumatic thought.
ALL is the main cancer for in babies.
How do you treat babies with cancer?
Just likely for age based on the age factor, we can treat the patients. See, blood cancer and ALL,
Ah, infant leukemia,
infant leukemia.
acute lymphoblastic leukemia, and acute myeloid leukemia. So answer looks okay to you?
Yeah, okay for me, but treatment is very critical for the babies. So we will wait for the amount of certain age.
Or you will not treat baby cancer?
We can treat, but we will wait for some age, like more than 1 year, 1 year, 2 years, like that.
Let me ask you, is it okay to treat
To treat
baby?
babies. Often necessary treat leukemia under age. All the infant leukemia is rare. So careful management. See, stem cell transplantation, bone marrow transplant.
Hmm.
So in particular, in 1 year of age, below 1 year of age, we can't do surgeries, right?
Yeah.
So if we take the case for surgery, we'll closely monitor and well alert and do surgery like that.
But you are saying, fortunately, cancer in babies is rare, right? It's rare.
Yeah, it's rare.
Okay, thankfully.
So it's rare, but most in most cases, only ALL is the main cancer for in babies.
So that's the only one kind. Okay.
Only two kinds of cancers, ALL and AML. We
Hmm.
can more chances is ALL.
Got it. Do you think, cancer cells can pass from mother to baby?
So, no, I don't think. Actually, I don't know that type. Sorry,
Let's ask this very
you
vague,
can
strange
ask.
question.
Vivek, what is leukemia?
Blood cancer. Leukemia is blood.
Blood cancer.
Okay.
Extremely rare phenomenon.
Rare phenomena.
Because placenta acts as a strong barrier.
So placenta is rare phenomena. So we don't. If mother is cancer, baby is not cancerous.
So
There
you're
are
saying,
only certain cases like one or two
so
in
a
10,000
cancerous
population.
mother can still give childbirth, huh?
Yeah, no
Okay.
problem.
Okay. Understood. Yeah, thankfully, at least babies are safe.
Safe.
So I want to ask a question. What lifestyle changes I need to do to make sure I'm safe from cancer?
You will free from smoking and pollution and don't eat outside food too much.
Have to have a boring life, huh? Okay.
Yeah, don't drink alcohol.
Oh God.
Avoid tobacco, first one. Maintain healthy weight to balance nutrition. Try to limit alcohol consumption.
Yeah, some of these are hard to follow, huh?
Yeah, get
Even
vaccinated
doctors,
for
I've seen doctors smoking and drinking. I don't know why.
tensions,
Okay.
stress
Okay.
and tensions.
Yeah, even doctors, some doctors smoke a lot.
Yeah.
150 minutes of moderate exercise per week. Okay.
So see, vaccinated from HPV and HPV viruses.
Ah,
So
oh,
environmental concerns like we will see pollution and everything, and
so at what
limit
age do these vaccines?
vaccine HPV is at birth. At birth, HPV is at birth.
So
But
older people like us
at,
don't need this vaccine, huh?
yeah, actually in our childhood stage there are no HPV vaccinations.
Hmm.
So nowadays they give HPV vaccinations to everyone. So
Okay.
like 3 doses.
So once we are grown up, we don't need these vaccines, right?
No. If you are grown up, we take vaccine also.
I mean,
So
I don't take any vaccines now. Do I need any vaccines?
some vaccines you take, huh?
Except the COVID vaccine, I didn't take any vaccine since I grew up.
Yeah, likely most of the vaccines are given to you on childhood.
Oh, so we are covered through
We
life.
are covered in childhood, like polio vaccine and everything,
Ah,
rabies
yes, yes,
vaccine,
got.
TD vaccines like that. But
Hmm.
some vaccines are developed later stages when you are grown, like you are in 8, 9, 10 standard intermediate, like
Right,
in
right.
that. So they develop so many vaccines like HPV
Hmm.
vaccines,
Hmm.
influenza vaccine, typhoid vaccine. Recently, for females, cervical cancer vaccine is also there.
Hmm. 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 Okay.
Okay.
So I'm just thinking what lifestyle changes I need to do. Avoid tobacco, maintain
Maintain
healthy
healthy weight.
and limit alcohol. That's a tough one. Protect your skin from excessive sun exposure. But sometimes they say you need suns. Other times they say you don't need sun. I don't understand.
So likely in previous there is one layer like ozone layer, right?
Right.
So ozone layer is protected from the ultraviolet rays.
Ah,
So, we use so many air conditioners and everything pollution. The ozone layer was broken like holes.
yes, yes, I know.
So the ultraviolet rays are directly infected on the skin. So there is some probable risk for skin cancers.
So, doctor, are we supposed to get sunlight or we should not get sunlight?
We should get sunlight. For morning sunlight is very good, like
Okay,
below 10, 9 or
okay.
10. Vitamin D is there,
So we need morning sunlight, but not the daytime
but
sunlight.
daytime sunlight,
Okay, because it has ultraviolet radiation. Okay.
ultraviolet radiations.
Yeah. So
So
air
that's
conditioner and this is
so
killed
that
the.
directly the rays directly infected on your skin. So maybe you get some of the skin cancers.
But what about all the people who have to go around the town, like delivery boys, taxi driver?
So you see, no, not other. Maybe probable risk, not completely risk.
So they have to use sunscreen, sunscreen.
Sunscreen and protective clothing,
Right.
everything.
Okay. Okay, so I guess we are coming to a logical closure on this. So hope that was interesting, Doctor. Any other final question you want to ask, Doctor?
No,
So audience, any quick question you want to ask of CellBot? Okay, so I'm assuming we are good. So friends, so idea is to get good healthcare information. If you think any of the bots like ChatGPT or others, are giving you good answer, by all means, our endeavor is to create a powerful, a medical research bot over sometime this year, and we hope to benchmark against the best LLM chatbots and give you better tools. But till that time, feel free to, because healthcare is so personal, so important for all of us. So feel free to use whatever sources. Dr. Prasanna, feel free to ask a question. Prasanna, you have a question? Okay. So that brings us to the end of this session. Hope you found it interesting. The idea was to, consult an expert like Dr. Akhil and see how he feels about these answers.